everyone, and welcome back to Medigap Show. I'm Holly Cohen, licensed independent broker. Today on the Medigap Show, we are looking into some noteworthy updates in the Medicare Advantage landscape. So let's dissect what's happening in our major health systems now. Recent reports highlight shifts in Medicare Advantage contracts within major hospital systems. According to Elizabeth O'Brien's recent report, affiliated physician groups and health centers, including those with San Diego-based Scripps Health, are undergoing changes in their Medicare Advantage plans. Notably, there are many hospitals in parts of the country that are leaving the Medicare Advantage program. For instance, Scripps Health physician groups filed termination notices impacting thousands of patients. Let's dig right into this article now.
This article posted on Barron's by Elizabeth O'Brien. Don't assume your doctor still accepts Medicare Advantage. Some are dropping the program. Now it's time for Medicare Advantage enrollees to verify that their doctors and hospitals still participate in their plan. Medicare's annual open enrollment period ends on December 7th. Until then, beneficiaries can pick a new Medicare Advantage plan, a new Part D drug plan, or switch from original Medicare onto Medicare Advantage and vice versa, meaning Medicare Advantage back to original Medicare. Any changes made during this period will take effect on January 1st, 2024. It's a good idea to check your plan's provider network every year and make sure all of your doctors and hospitals are still in network for the following year if you're on Medicare Advantage. But it's become even more important now that some major U.S. health systems have recently canceled or plan to cancel their contracts with Medicare Advantage, according to Becker's ASC review, which I'm going to read in a moment. Among the latest examples, two physician groups affiliated with San Diego-based Scripps Health, which filed termination notices with Medicare Advantage plans used by thousands of San Diego County patients, effective January 1st, 2024, as well as Cameron Regional Medical Center in Cameron, Missouri, which canceled contracts with Cigna and Humana Medicare Advantage plans. The Cigna termination took effect on January 1, 2023, and the Humana termination took effect this September, says Joe Abrutz, the hospital's administrator. Humana tries to provide access to a wide range of healthcare providers. We do remain open to future discussions with Cameron Regional Medical Center regarding participation in Humana's networks, said a Humana spokesperson in an emailed statement. Cigna did not respond to a request for comment. Be sure that the doctors and specialists and hospitals that matter to you are in a preferred plans network, says Tricia Newman, Executive Director for Program on Medicare Policy at KFF, Kaiser Family Foundation, a nonprofit health policy organization. The best way to do so is to call the doctor's office directly, since online provider directories can be out of date. About half of the nation's 65 million Medicare beneficiaries are enrolled in Medicare Advantage, which is run by private insurance carriers that contract with the government to provide bundled Part A inpatient hospital coverage, Part B outpatient coverage, and often Part D coverage. By contrast, original Medicare, also known as traditional Medicare or fee-for-service Medicare, is run by the government. Original Medicare has no network of participating providers. Beneficiaries can visit any doctor or hospital in the country that takes Medicare. Canceling Medicare Advantage contracts carries serious consequences for both health systems and patients, Newman says. The health system could lose patients and revenue, while patients could lose access to trusted providers and face disruptions to their care. So why would the health system take such a step? Those that terminated their relationship with Medicare Advantage cited low payments and administrative hassles among the reasons for their split. Becker's ASC review reports many Medicare Advantage plans require what's known as prior authorization before certain prescriptions are filled and procedures performed. This creates more work for the provider and can cause delays and even rejections of requested care. A report last year by the U.S. Department of Health and Human Services Office of Inspector General found that among the prior authorization requests that Medicare Advantage organizations denied, 13% met Medicare coverage rules. In other words, a patient with original Medicare would likely have had no problem accessing that service or medication in those cases. Those who don't want to face as many prior authorization requests or restrictions on the providers they seek could consider switching back to original Medicare. While that move is always allowed during open enrollment, which is annual enrollment period, which is happening right now, keep in mind that with a few exceptions, you're not guaranteed the right to buy a Medigap supplement outside of your original eligibility period when you first enroll in Medicare. At all other times, your health status could disqualify you or cause you to pay more. Without a Medigap plan, you're on the hook for about 20% of your covered care under original Medicare. Those on Medicare Advantage will have another chance to switch plans from January 1 to March 31st of next year during the annual Medicare Advantage open enrollment period. But to the extent that you do the legwork now, it will help you avoid unpleasant surprises in the new year. Here we are over on Becker's Healthcare. The story is this. Hospitals are dropping Medicare Advantage plans left and right. 13 updates. Written on November 16th, which was last Thursday. Medicare Advantage provides health coverage to more than half of the nation's seniors. But a growing number of hospitals and health systems nationwide are pushing back and dropping some or all contracts with the private plans altogether. Among the most commonly cited reasons are excessive prior authorization denial rates and slow payments from insurers. Some systems have noticed that most Medicare Advantage carriers have faced allegations of billing fraud from the federal government and are being probed by lawmakers over their high denial rates. It's become a game of delay, deny, and not pay, Chris Van Gorder, president and CEO of San Diego-based Scripps Health, told Becker's. Providers are going to have to get out of full risk capitation because it just doesn't work. We're at the bottom of the food chain, and the food chain is not being fed. In late September, Scripps began notifying patients that it is terminating Medicare Advantage contracts for its integrated medical groups, a move that will affect more than 30,000 seniors in the region. The medical groups, Scripps Clinic and Scripps Coastal, employ more than 1,000 physicians, including advanced practitioners. Mr. Van Gorder said the health system is facing a loss of $75 million this year on the MA contracts, which will end December 31st for patients covered by United Healthcare, Anthem Blue Cross, Blue Shield of California, Centene's HealthNet, and a few more smaller carriers. The system will remain in network for about 13,000 Medicare Advantage enrollees who receive care through Scripps individual physician associations. And then they go on to say, I feel terrible for the patients in this situation. It's the last thing we wanted to do, but it's just not sustainable with these kinds of losses. Mr. Van Gorder added, patients need to be aware of how this system works. Traditional Medicare is not an issue. That's amazing. With these other models, seniors need to be very wary and savvy buyers. Okay, so I'll include this link down below. Here's a key takeaway. Initiate direct communication with your healthcare providers. The online directories may lack the precision needed for these major decisions for you to make sure you're on the right plan for 2024 if you are on a Medicare Advantage plan. That concludes today's comprehensive analysis on Medicare Advantage and what's going on in some of the plans across the country. If you found this episode informative, go ahead and hit that like button and subscribe for more updates on Medicare. Also, feel free to share it within your community. I'm Holly Cohen, host of Medigap Show. Thank you for joining me today. Remember to be proactive and make your decisions prior to December 7th. Don't wait till the last moment. Things get crazy in the last 2 weeks of this time frame in the year. So try to figure everything out as soon as you can, better even maybe before Thanksgiving,
After Thanksgiving, things get really crazy because everyone's trying to get in under the wire. If you have any questions, always reach out to us at 855-265-6334. We're happy to help you and give you any information you need. If you're on Medicare Advantage, we're happy to provide all the information about those plans. We do represent those plans as well as Medigap, and I'm here to help you. For now, and as always, please be well.